Greetings to you all. The topic of my lecture is Nutrition Care Process, NCP. What is Nutrition Care Process? It is a systematic process describing how food professionals provide care for their patients or clients. There are 4 steps in nutrition care process, and each of these 4 steps have domains under them. The first step in nutrition care process is nutrition assessment. What is nutrition assessment? It is a systematic approach by which food professionals assess to obtain, verify, identify, or interpret data they use in diagnosing their patients. I mean, assessing their patients, the process of assessing their patients. In order to obtain data, verify it, interpret it, and use it for nutrition diagnosis and the cause of the diagnosis and its significance or signs and symptoms of the diagnosis. Domains in nutrition assessment. From these domains are where your assessments are coming from. Each of your assessments must follow these domains. The first domain is food or nutrition history. You can call it diet history. The second domain is anthropometry measurement. You use your tools to obtain this data. The third one is biochemical data, medical tests and procedures. These involve the patient's lab results, which you can always find in the patient folder. The fourth one is client history. Client history can be family social history, past medical history, and the rest of them. And the fifth one is nutrition focused physical findings. You can also call it clinical assessment. These are the place or where you derive your assessment from. These domains guide you to make your assessment very well. I advise you to do a detailed nutrition assessment. Leave no one behind. If not, you will find it difficult to make the right diagnosis for your patient. Nutrition diagnosis is the second step in nutrition care process. What is nutrition diagnosis? It is the problem that the food professional identified from the nutrition assessment, in which he is capable of managing or treating with nutrition intervention. Nutrition diagnosis is the problem that the food professional identifies from the nutrition assessment that he or she is responsible for treating or managing with nutrition interventions. Nutrition diagnosis have 3 domains under it. The intake domain, clinical domain, behavioral environmental domain. Your diagnosis, your nutrition diagnosis must come from these three domains. If not, your diagnosis is wrong. And note, you don't just pick from any of these domains so that your diagnosis will come from any of them. No. In this place, you need critical thinking ability. Critical thinking. The critical thinking implies that your problem must come from your assessment. The cause of that your problem must come from your assessment. Your signs and symptoms must come from your assessment. Secondly, that's your problem, that's your diagnosis. The cause of that your diagnosis, is it really the cause for that diagnosis, for that problem? That thing that you pick as the cause, as the etiology of that problem, is it really the etiology of that problem? That is the critical thinking. The signs and symptoms, are they really the signs and symptoms for that problem, for that your diagnosis? If not, your diagnosis is wrong. In nutrition diagnosis, we make use of PES statements: problem, etiology, signs and symptoms. That's your problem, etiology, signs and symptoms must have relationship. They must have relationship. The three must be related. If not, your diagnosis is wrong. There are 5 questions you need to ask yourself when making nutrition diagnosis. The questions are: my PES statements, do they have relationship? Are there any relationship among the three? My P and my S, that's my problem, my signs and symptoms. My signs and symptoms, are they really the signs and symptoms for that my problem? The third question you should ask yourself: my diagnosis, is it coming from dietetics diagnosis terminology? That is the question you ask yourself. The fourth question is the etiology. My etiology, is it what I can intervene on as a food professional? The last but not the least, my signs and symptoms, are they measurable? Can I measure them? Can I use them to monitor the progress of my nutrition diagnosis as I intervene on this patient? These are the 5 questions you must ask yourself if you must get these things right. When your diagnosis cannot provide answers to these your questions, it means that your diagnosis is wrong. You have to go back to make a new diagnosis. Go back and make a new diagnosis if it is not in line with these questions and their answers. Third step in nutrition care process is nutrition intervention. Nutrition intervention are the actions the food professional is going to take or provide in order to manage the diagnosis made from nutrition diagnosis. These actions are the right actions to handle the diagnosis of the patient. In this nutrition intervention, there are 4 domains under this. We have food or nutrient delivery. We have nutrition counseling, nutrition education, coordination of nutrition care. This nutrition intervention has two factors that must go together: planning and implementation. Number one thing is to plan, another thing is to implement. While delivering the food to the patient, we now do what? Counsel the patient. That is the second domain, nutrition counseling. Third one, nutrition education. Counsel the patient, educate the patient why he or she needs to adhere to this dietary management. Tell him what he doesn't know or what she doesn't know as regards to dietary management. The next one is coordination of nutrition care. If there are other things that other health professionals can do in order to make your work perfect, relate to them so that you all will achieve a better result in that patient. The fourth step in nutrition care process, NCP, is nutrition monitoring and evaluation. This nutrition monitoring and evaluation tracks the outcome of the nutrition intervention and intervention goals of the patient. The food professional has made intervention. He or she has derived out the goals he needed to achieve in this patient. This monitoring and evaluation will now measure the outcome of the interventions made. This means, are these interventions really making impact in this patient? Are these interventions the right intervention for this diagnosis made? Is there improvement? You find out the improvement, that is the outcome. You measure it with the reference standard. In science, everything has reference standard. You compare with the reference standard. There are 4 domains under this monitoring and evaluation. They include the anthropometry measurements. You measure your anthropometry with your tools. The second one is diet history. The diet history of the patient, or food or nutrition related history of the patient. The biochemical tests and the nutrition focused physical findings, what we call clinical assessment. If you watch these domains, these 4 domains are the domains under your nutrition assessment. After assessing patients under these domains and you discover any problem, whether from anthropometry, diet history, biochemical, or clinical assessment, you have to monitor it in your nutrition monitoring and evaluation. You monitor it, you evaluate with the standard because it is already a problem. That is why you should treat it, you monitor to know if your treatment is really making impact. If there is outcome, positive outcome in your treatment of that patient. Note that client history is not involved in the domains under nutrition monitoring and evaluation. Why? Because client history does not change as you monitor this patient. That is to say that client history is a constant factor. It doesn't change. I advise you to listen to this lecture again for you to understand it from the nutrition assessments, nutrition diagnosis, nutrition intervention, down to nutrition monitoring and evaluation, and the domains under them. so that you'll be able to manage your patients or treat your patients well as a food professional. Thank you.